Britain's free healthcare turns 75, but can it survive the next 25? Hello, I'm Leanna Byrne and you're listening to the Marketplace Morning Report, live from the BBC World Service. Thanks for joining us. So here in the UK, we are celebrating the 75th anniversary of the National Health Service, or the NHS as it's called. And the NHS, it was the first time anywhere in the world that completely free healthcare was made available on the basis of citizenship rather than paying fees or insurance premiums. And most in Britain consider the NHS to be an outstanding success. But the service, which costs about $200 billion a year, is facing extreme pressure from record waiting lists, staff shortages and strikes. And leading health think tanks are warning it won't reach its centenary unless there are long-term reforms. Our reporter James Graham caught up with Dr. Andrew Meyerson, an American who trained in the UK and now works in a London ER department.
The NHS is what Americans would be scared to hear as a socialist healthcare system. But it is a remarkable achievement that 75 years ago, after World War II, the British people decided that healthcare is a human right and that everybody should have access to it, whether you are rich, whether you are poor. What they did was they made a very simple system. They said, okay, we are going to take all of our tax money and we are going to put it into this cause because it is important for the public to be healthy. As recent as 10 years ago, the NHS was ranked the number one healthcare system on the planet. And if you look at how much money is spent on American healthcare, it's double what we spend here in the UK. So we waste less money, far less money. And 10 years ago, we were having, similar outcomes, actually quite better in many different respects. But over the last 10 years, it has been run into the ground.
Since the 1950s, the general trend, the average spending growth has been about 4%. But exactly. As you say, in the last 10 years, that dropped well below that. Yeah. But the current government has tried to give it a financial boost. Unfortunately, a lot of that it will be wiped out by inflation, but it's still, I think, in the coming years below the 4%. So what are you seeing on the ground then? What's the experience of working there like?
10 years ago, we were seeing patients in the emergency department in, well under 4 hours. People are getting high quality healthcare delivered through taxation, no medical bankruptcies. I think there's over 500,000 medical bankruptcies in the United States every single year. There's no medical debt here because of this extraordinary system. But now, after a decade of massive underfunding, of massive underplanning, we are seeing some really, really worrying, terrifying statistics. So right now, people can wait, 12 hours and more to be seen in the emergency department. It's taking weeks for them to see their general practitioner. It's taking months for them to start cancer treatment.
The NHS is a massive employer with more than 1 million staff, but it's got this huge vacancy rate of about 1 in 10, hasn't it? Funding is obviously an issue, but staff vacancies must be really difficult to deal with on a day-to-day basis.
Oh, incredibly so. If you look at any NHS hospital, nobody's well staffed. And it's quite rare for us to be on a shift where we have adequate, safe staffing levels every day of the week. For the last number of years, we have been trying to highlight these issues through the right channels to speak to the government, to let them know that this is an existential crisis for the NHS. We do not have enough doctors. We do not have enough nurses. We have among the lowest numbers of doctors and nurses, anywhere in Europe. And this is a crisis that's getting worse and worse and worse. And then after the pandemic, when we were asked to do so much, and that's why, we have said enough is enough. That's why you see throughout the health service in the United Kingdom, the nurses have gone on strike, the radiographers have gone on strike, the doctors, we've had, 3 months of action so far. And our senior doctors, what Americans would call, attendings, our consultants, they have just voted to go on strike as well. This is a systemic problem that the entire health service is screaming about, saying that patients are suffering on a daily basis. When not a single NHS worker is on strike, patients are suffering from poor staffing levels every single day of the week. This is a crisis that's getting worse and worse and worse. That's why we look at this and think, this is probably by design, because they want to push people into private healthcare. And you're seeing a proliferation of private healthcare services in this country like never before.
The King's Fund, a think tank, did say there was no evidence of the NHS as an institution being broken up and privatised. But separate figures showed that, in the last couple of years, the number of people paying for private operations has jumped by about 25%. When you talk about privatisation, is that what you're seeing, that people just can't wait, so they're borrowing money or spending their savings to use those private clinics?
That's part of it. So they're pushing people into a private healthcare sector. That's why, we're starting to see medical debt in this country because of that. But it's also, there are pieces of legislation over the last decade that have made it much easier for private companies to come in and take NHS services.
Do you think you'll stay with the NHS?
I'm NHS for life. Until the United States, we get, good universal healthcare and solve the issue of guns, I'm staying put right here because I love the NHS.
That was Dr. Andrew Meyerson. Now, let's do the numbers.